Thank you for the opportunity to share my experience with you and what I've learned from it and what I decided to do going forward after that particular experience. So how did it all start? So somewhere around the 21st of May, especially on the 21st, I believe it should have been a Thursday. I had visited a project site somewhere in East Lebanon to see some work being done for me. And whilst I was there, I felt very uncomfortable. I noticed that my temperature was running, and I felt feverish. So I came home. And so whilst I was lying down, my son, I picked up the thermometer and checked. My temperature was hovering around 38, 37. Well, I took some painkiller and I slept. And the following day, I got up, and this is a picture of me feeling very, very uncomfortable during that time. So the following day, yes, I noticed that still the temperature was running, and I was feeling feverish. So I spoke to my doctor, and she advised that I take some painkillers. So this was, I think I spoke to the doctor on a Friday. So throughout the weekend, I took some paracetamol. A friend who was a doctor came by to visit me. So we even did the rapid malaria test at home. And when we checked, there was no malaria parasite, but then he advised that I should still go to the hospital or go see my doctor. So the Monday after the 21st, I went to see my doctor. When I saw my doctor, we ran a malaria test. We ran a test to check whether there was typhoid or there was any infection. And she realized that there was nothing like that from the test that she conducted. So what she did was give me some painkillers and some antibiotics. But then she said she would want me to do a COVID test. So I was requested to have a COVID test. By the day, I was feeling weak, even up until I went for the COVID test. In fact, the day I went for the test, I was struggling. My wife had to drive me. So I did a test on a Friday. The results were supposed to be in by the Monday or Tuesday. I believe the Monday was the 1st of June. But by Monday morning, throughout the weekend, by Monday morning, I was extremely weak. And this is someone who was doing between 6 and 8 kilometers walk a day. And I had a group of friends that we are challenging ourselves that we want to hit 100 kilometers in a month. So averagely, I was walking between 6 and 8 kilometers a day. And within this period that I fell ill, it got to a point I could not take 10 steps. So apparently one of my friends had also spoken to a specialist and had explained my situation to that doctor. And that doctor had advised that he should find a way to get me into a public hospital. But I didn't know. But then on the Monday, the way I thought, I had also mentioned to my wife that I needed to go to the hospital. Indeed, I called my doctor again and I told her I was still feeling uncomfortable and therefore I needed to go to the hospital. And she thought that if the results wasn't in, whatever medication she had given me was okay, and therefore I need not to go anywhere, but I should wait for the results. And I mentioned to her that I can't wait. I mean, it was terrible. So My friend had also spoken to my wife and um, mentioned to her that she also had to make sure that we go to a public hospital. And then my friend had also called me. But at the time, I'd already made up my mind that I was going to the hospital anyway. So we agreed to go to test 7. My wife drove me to 7. So the first picture you see on the left is my arrival at test 7. And as soon as I got to test 7, as soon as I got there, and the nurse took my temperature and checked my oxygen level and what have you, she immediately put me on oxygen. So I was seated, and there was a cylinder by me, waiting to see a doctor or waiting to be attended to. So I hadn't gone through anything, but I had been given an oxygen. So she even asked me whether, how do I see my breathing? And I thought that I was breathing well, but except that I felt weak when I was walking and so on and so forth. Said, oh, my oxygen level was low, so they had to put me on oxygen. So shortly after that, an X-ray was taken. And when they took the X-ray, they noticed that I had a lung infection. I had pneumonia. Fortunately, I had another friend, a couple of friends who were also working at test 7, and some of them were doctors. So my friend came to me and said, look, he had seen my X-ray results, and the kind of what he's seeing, it looks like it's COVID. So we need to do a COVID test. Then I indicated to them that I had already done the test before coming there. I did a test on Friday, and I was expecting the results that day or the following day. So I was quickly admitted to the emergency ward, and I was actually even pushing for one of their private wards to be taken to, because I had gone to the emergency ward and it was chaotic. It was really, really pathetic. So I said, oh, I was ready to pay if they would take me to the a private ward. And then he came to me and he mentioned that the way it's looking like they suspect until my results come and it proves that it's not COVID, they cannot take me to a private ward, and I have to manage with the emergency ward till the following day. Fortunately, the following day, which was the 2nd of June, I believe, I got the test results. In fact, initially, because the test had indicated that I was positive, when I called the clinic, they were reluctant in releasing the results to me. My previous one, as soon as they got the results from Gucci, they sent it to me by text and WhatsApp. At this time around, when I called them, they were giving me one excuse to the other, and I was wondering. So I had to tell the nurse that, look, I'm feeling very terrible. I'm at 37 on admission, and I need to get the results so that we know what the doctors can decide on what to do. And then she mentioned that anyway, I was going to get a call from the National COVID Center. I said, look, if I've tested positive, just tell me, and I'm not one of those who would behave differently, so that I know what to do and psych myself up and so on and so forth. So yes, she finally sent me the test results, and it was positive. And then I shared it with the doctor. So immediately I needed to be isolated. So the middle picture and the third one are pictures of me when the results came, and I had to be moved into a small room just at the emergency ward. And I think 2 other people were brought in later on. And again, you can see I was still on oxygen. I was so weak that even if I had to go to the washroom, I needed to sit in a wheelchair to be pushed to the door of the washroom. And even getting up and taking the 5 or so steps to the washroom was just a miracle. I think they went back and forth and then eventually decided that I had to be taken to the Airwork Treatment Center at the Airwork Stadium. So this was on the 2nd, and on the first picture you see there was me being sitting in the wheelchair and being pushed into the ambulance. I was being wheeled into the ambulance. The ambulance is a vehicle you see there with the tie showing. And that is how the Airwork Treatment Center looks like. So they're basically military tents that have been created, were air conditioned all right, but there are no washrooms there inside. If you want to use the washroom, you need to walk about 100 or 150 meters to use the washroom. And that's where I was taken further. I left 37 at around about 4 p.m. or thereabouts, straight in the ambulance and straight to Airwork. When I got there, still on oxygen, when I got there, I had to be in the ambulance for another 20 or 30 minutes before I was taken into one of the tents, or we call them wards. The 2nd of June, I was transferred to the Airwork Stadium Treatment Center. Straight away, I was put on a bed. There was oxygen on me. I think 2 hours into me settling in there, I ran out of oxygen. And it took about 5 hours for the oxygen to be replaced. So indeed, even when they came, I had to be moved from my bed into another tent where they said there was oxygen connected to the bed, so I'll be fine. Then I was moved to that bed to around about 2 a.m. I ran out of oxygen again. The mystery in all this thing, for me personally, was how I managed to survive from Tuesday night till the Wednesday morning. So what happened was that whilst they kept saying that they were donning their PPEs and oxygen is going to come, and oxygen wasn't coming, and I was struggling. I was getting worried. At the point, I honestly felt that that's where I'll end my life. I had to make some calls on friends to give them pressure to call the doctors at 37 that my oxygen is not coming and what have you, and so on and so forth, and I'm struggling. And indeed, even in the tent, there are no phones. So there happened to be some walkie-talkie that those in the tents will be using if they want some assistance. And even when I moved to the other tent, there was even no walkie-talkie when the oxygen ran out around 2 a.m. The person was lying by me in that particular tent that I was moved into was some elderly woman who was also struggling. She couldn't offer me any help. So it was actually a miracle how I managed to survive from Tuesday night till the morning of the 3rd. After I had recovered and had interactions with some of the doctors at T7, they also indicated to me that yes, at that time, they had some challenges with oxygen. I was lucky that it was agreed that I'll be transferred to UGMC. So at about 4 p.m. On the 3rd, an ambulance came from UGMC to pick me to UGMC, and that's me in the ambulance. Images of UGMC outpatient department. But one of the things that happened on the Wednesday before I left was that I did not, like I said, I did not have oxygen from about 2 a.m. to the morning. And if I had to pass urine, there was a small pile there that I would use. If I got up from my bed I don't even take about 3 or 4 steps, but how to even get back to my bed was a huge challenge. And when I got onto the bed, the way I'll be panting, oh God. When a request was being made for me to be sent to UGMC, they were even reluctant to accept me. So there was a bit of calls here and there. So eventually, but I must say the folks there are extremely, extremely professional. And for me, if I hadn't been moved there, I knew I would not be sitting here today. So this is me at the ICU at UGMC. And as soon as I entered the ICU, I was assured, the doctors assured me that I'll be fine, and they took me through the procedure and what they would do and so on and so forth. Yes. Fortunately, I spent only 2 days in ICU. I had met people at UGMC who had spent 13 days. In fact, there was a gentleman who was in coma for 13 days. There was someone I met who had been at ICU for over 2 weeks. I know somebody who got there and didn't know how he was there. When he opened his eyes, he thought he was out of the country. The place is fantastic, well set up. Doctors are extremely professional. Nurses are awesome. The treatment is good. I spent about 2 days at ICU, and then I was stepped down to the ward. But when I was being stepped down, I still had an oxygen on me. Had an oxygen by my bedside in the ward for another 3 days or 2 days or so. I think one morning I got up and I just decided that I'll do away with the oxygen, and paced up around the premises. I came back feeling a bit tired, but then I said to myself that, look, I'll not be on oxygen for the next day, so I better psych myself up. After a couple of days, I started feeling better, and this was about the first time I'd come out to get some fresh air when I was taken to UGMC, and that was a picture I took of myself the very first day I came. And then on the right, it's the first time I got some friends visiting me. You know, when I meet people who think that COVID is not real, I share my experience with them, and I tell them that they have to be careful. They don't need to take things for granted. I was one person who was a bit paranoid about the protocols. I had come back from I had returned into the country right from the 16th, and I wasn't going anywhere. Nobody in my house was really going out. I would hardly even attend meetings. Yet I got it. I'm unable to tell where I contracted it and so on and so forth. So it's serious, and we need to be more cautious. I am one of those people who is even more worried with the way people are conducting themselves lately, thinking that Koro is gone, and therefore we have to behave anyhow. Yeah, but again, because of my experience, and whilst at the hospital, even though the doctors and nurses were doing their best, and they were selfless and what have you, I also saw some real challenges, and therefore it brings me to this organization called Green Gratitude. So yes, I realized that in spite of all the hard work and the efforts that the nurses and the doctors were doing, they were having some real challenges. In fact, I overheard a conversation between 2 doctors, and this is how I started this thing. And one doctor had called a doctor that I was having a conversation with, and was complaining that the staff were complaining about their food and what they were going to do. So after their conversation, I asked him what the problem was, and he said, "Oh, they were being fed, but it appears that they are running out of funding for feeding or so. So now they are likely not to be getting food." And I said, "Oh wow, how is that possible? The patients that we are being taken care of, we are getting 3 meals a day: breakfast, lunch, supper. So if a nurse and the doctor who is supposed to take care of me is not going to get food, I'm even scared the doctor will come in the right shape of mind, or the nurse will come in the right state of mind to attend to me." So once I was at the hospital, I offered to provide lunch and dinner for them. I did that for about 4 or 5 days or so. And then I said to myself that with all the things I've gone through and the experience that I'd had, and I remember whilst I was at test 7, I think one of the conversations I had with my wife was that, look, we need to impact on people positively in life, but she should look at the way people are checking on me and people are trying to support and find out what to do to help me. And I believe that this is just because of the small way I have touched other people's life, and that's why I'm getting all this attention. So yes, I started feeding them for 4 or 5 days, and I just said to myself that I could have lost my life each day, even if I had $1 billion sitting down. Right? It would have meant nothing, and therefore, why can't I come out and try and do something small by way of contributing my quota? Because I'm one of the people who share the view that government cannot do it all. In fact, I got to know that for the 3 or 4 days or so that I was at ICU, the cost on me was about 72,000. So you can imagine those who have spent 13 days, 2 weeks, and so on and so forth, the cost. So government, my view is that government may not be able to do it or can't do it all. And therefore, we should find ways in our own small way to support. So when I was discharged, I called on friends and I said, amongst the many things that I want to do or want to mobilize resources to do for basically frontline workers, nurses and doctors across board, I was shown love in the most amazing way by the frontline health workers at the various medical facilities. And I was inspired by their selflessness and professionalism. So I decided to birth this non-profit organization called Green Gratitude. We started feeding and providing a meal a day to nurses and doctors at UGMC. We've done that for the past 5 weeks. We also started, in fact, 7 weeks in total. We also started providing meals to the nurses and doctors at Elwak Stadium. I have gotten some organizations, for instance, some restaurants like Puka, who has also decided that for every month they would give us some packs of meals to distribute to some of the nurses and doctors around in the front line trying to help. But we're not limited to just feeding. The feeding was just the first initiative based on what I had. For instance, over the last 2 weeks or so, I got somebody who was we came to realize that, for instance, some of the nurses close as late as midnight. And for instance, when you take UGMC, they need to walk from UGMC, that's around Nguchi, to Okonglo Junction to look for a bus or a taxi to go home. So in my discussions with the CEO, I got to know that one of the things that they even want to provide for the nurses and doctors is a bus. So 2 weeks ago, I got a friend who heard about Green Gratitude whilst I was on radio, and decided that he wanted to donate some money. So I made sure they did a direct donation of 10,000 cedis towards the purchase of the bus to UGMC, which they've done about a week or so ago. So the focus is not only on providing meals. It was the first intervention, so to speak. We are considering even having a day for nurses and doctors just to show appreciation. Just an image of the day that it was launched. These are basically images, a presentation of packed meals and water and other stuff that we did for them. This was a presentation of meals to my first COVID center, which was 37. And this was my interaction with the commander of the 37 Military Hospital on the left, and after which I also sent some meals. I've done several interviews, including TV3, including interviews with Israeli, and so on and so forth, including your good self that I'm presenting to. I've had the opportunity to present to a lot of groups over the last 5 or so weeks, and I'm always happy to share my experience. I'm always ready to let people know that COVID is real, and in spite of all the easing ups that we are experiencing, we need to be extra careful, and hope that we'll find a vaccine soon. So in short, I think that my experience has totally changed my perception about life. It's given me a new perspective, and it's given me great respect for our health workers. And with this, I hope you would all be supporting the health workers when you get the opportunity to do so, because I can assure you they are the people who can save our lives. Your money will mean nothing at a point in time, and I'm most grateful for the opportunity. If you want to support Green Gratitude, I have our Momo number there and our merchant number there, and you can support, and you can be assured that it will be well accounted for. So folks, I'm very grateful for the opportunity, and thank you.
Thanks for sharing your experience once again. I think I have listened to you like this, like the third or the fourth episode, and I still I don't get tired of your experiences. It's just because I've been trying to pick one or two things in terms of the lessons here and there. But I just want to ask you personally that with the two scenarios that you painted, like from 37 to UGMC, I was hoping that you really kind of put some recommendation that our leaders need to pay attention to the infrastructure of this country. Because I'm just imagining that, just assume that there was no UGMC. You yourself, you admitted that the situation would have been different. So in your presentation, I was hoping that you make that strong recommendation, since you've gotten platforms that are very big now, for people to listen to you, that as we plan for this country, it would just be good that we put certain infrastructure things in place so that in case of disasters like this, we'll be ready. Because I'm saying that if not for UGMC that gave you the proper care that you needed, maybe things would have been a lot more worse, not for you per se, but for citizens in general. I don't know if you agree with me.
Well, yes, I do. I mean, uh, considering that I had seen situations that somebody had to come all the way from Takrady, a husband and wife drove all the way to Takrady to get to UGMC, only for the gentleman to be taken to ICU and died within 30 minutes because his oxygen level had dropped about 58 because there's no ICU in Takrady. That broke my heart. And this is somebody who has ended up becoming part of my family. I call the spouse almost every day just to check on her. 46-year-old man just going like that, just because there was no ICU. And they were not the only person who had come from Takrady. Like I did mention, there was a gentleman that I met who spent 13 days in coma. He also came from Takrady. Okay, I met about 3 or 4 people who had come from Takrady, and just because of that, if there was, and I think it is, well, I want to believe that it is from that maybe the president also has decided to embark on this hospital at every district project because I think it's needed. It's strange. Look, there was a Chinese man, and I'm told one of the richest, wealthiest Chinese people in the country, and it probably even in China. At a point in time, he also came with his wife. They were all admitted. At the point in time, he was looking for people to give money so that they can just save his life. I mean, I was approached because they felt that I had because of what I was doing and the rapport I built with the nurses and doctors, I could connect to them and give some money. They had to force themselves and come and do a donation even at the hospital. But his situation was so bad that he passed. They had to call, they had a video call with one of the topmost doctors in China to talk to the people at ICU. The doctor they did a video call, he saw the setup there and he was marveled that he didn't even want to believe that we had such a setup there. But nothing could save his life because the situation was so bad. So I totally share your view. And I think that in platforms that have the policy makers and decision makers, when I have that opportunity, I share that. And I always say, if it's not for UGMC, one probably wouldn't have survived. And I saw the profile of people who were running to UGMC and so on and so forth, both high and low. So yes, Richmond, I totally agree with you.
Yes, the country will have to move forward. Decisions are being taken. First one we know is the borders or the airports that is being opened. And there are different opinions. So people think that, look, that's a way for new streams to come into the country. I really don't know. I mean, I haven't really interrogated that argument. But then it informs us what we also need to do, particularly with regards to the support for the health professionals. Because I don't know whether they are still being provided the buses free of charge like it was happening. You are doing meals. What else is being done for them? So maybe if you can just tell us. I mean, are many organizations still supporting them, or it's waning?
My contacts or my experience was more with UGMC and L37. So those are the two places I've been talking to. I know initially they were getting support. In fact, the last time I spoke to the CEO of UGMC, he was sharing some thoughts with me on some of the things they want to do. For instance, apart from the bus, they were trying to. He mentioned an equipment that they want to purchase. I think it's a sort of a PCR equipment. It's an equipment that would help them do the test more rapidly and so on and so forth. So there are a lot of things that they need to do or things that they require. It also depends on the kind of support they get. Like I said, for me, my focus is on the health workers. The other parts that has to do with the emotional support and motivational support we can give to them so that they feel more energized to do their work. I can tell you one of the mornings, a nurse came to my room to take my vitals, and she was visibly shaking. And then she spoke to me. I said, "It's a Russel. Charlie, the emotional torture and the financial drain on me is not easy." And you know, they were promised some 50% extra or something. And I think at that time that had been paid. And you could tell that this is somebody who was ready to work, but she was struggling. Sometimes even how to come to work was a problem. That very day when she said that, I just moved 500 cedis to her. But the point is that maybe it is just something small. Maybe, for instance, if she has access to a free bus, she can save something small. Maybe she's spending all the little money she has on commuting to work. And can you imagine if this person hasn't got money to go home and she's closing at midnight? What will she do? So I have decided that for me, I'll work hard for the frontline worker or the nurses and the doctors, because yes, government will do its part. I will do the part that would directly affect them and motivate them and energize them to do more.
So on this note, I'd like to thank you, Russel, for taking time off whatever you're doing. For all of you, ladies and gentlemen, thank you. You could have been doing something else, but you took time to listen to this. I believe that we've all taken inspiration from this. We'll come up, we'll continue the conversation on this, and then we'll see the way forward.